And our latest bout of severe weather serves as a reminder to always stay prepared.
But preparing for a storm doesn't just mean boarding up windows and filling up sandbags. News 15's medical editor, Dr. John LaPree, he breaks down how to be prepared for medical emergencies during severe weather conditions.
With any storm, there's so many things to think about, but I want to talk about medical considerations. The first thing to consider is our inability to access your outside records. Outlying hospitals and pharmacies are affected by the same power outages or computer problems, and we often can't reach them. That's why it's so important to carry your basic information with you, either a written record or a copy on your phone. So what information should you carry? The first is past medical history, and by this I mean any significant illness I need to know in an emergency. Next is a surgical history, any major surgeries and the approximate date. I need to know what medications you're taking, more importantly the doses and how many times per day you take them. Also be sure to keep this list updated. Medications change often. And finally, I need to know your allergies. You'll be giving this list to several people and it's a high likelihood it'll get lost. I prefer you keep a safe copy on your phone. Now some final thoughts about medication. When possible, we really prefer the actual pill bottles. They contain a wealth of information, including dosage, when prescribed, and how to take it. Also, your pharmacy name and number in case we need to call or transfer your prescription. And finally, we often find medications have been added or changed when compared to your original list. During a major storm, we see people evacuating from other areas. They often arrive ahead of family members. That's why it's so important to have this critical information handy. So make your list and stay safe. Wishing you better health. Dr. John LaPree, News 15.